facing the continuous spread of COVID-19, and we've seen mutations of the virus. Therefore, we have to encourage the vaccination process and guard against a rebound. As of now, the total doses of injectionation have exceeded more than 200 million, and we've heard people complain about the hardship of making reservation for second jab, for the booster injection, and we've already asked the local government to make sure that the second injection can be administered within 8 weeks after the first injection was administered. And the theme of today's press conference is the vaccination rollout of China, and we have speakers from the NHC and Mr. Li Dachun from the Medical Administration, and Mr. Wang Huaxing from China's Center of Disease Control, and Mr. Shao Yiming, a vaccination expert. And now let's start today's press conference. You can raise your hand as a signature for raising a question, and please identify yourself before that. First question. Thank you. With Renmin Daily, according to the latest statistics, the number of vaccination has already exceeds 200 million. So can you tell us more on the specific situation of vaccination, especially the vaccination for the priority populations? Thank you for your interest in our work. According to the arrangement of the Central Party Committee and government, we are now pushing forward the vaccination rollout nationwide. And currently, the process has been quite smooth. As Mr. Li, our moderator, has mentioned, as of now, a total of 200 million doses of vaccine has been administered. To be more exactly, the total number of doses, as of yesterday, it was 198 million doses. So today, it has already exceeded 200 million. So we have two priorities in our work. First, the key areas. We need to prioritize the areas with higher risks of rebound, for example, borders in major cities and ports, as well as places where rebounds happened before. So far, the key areas, after careful arrangement and planning, we have expedited the rotation of the vaccine and the deployment of the vaccination. Second, key populations, including workers working at the logistic department, medical workers, and public servants, university students and faculty, and service providers at the major supermarkets and shopping malls, as well as people who are working at the transportation and welfare system. To see to it that our work is progressing in a smooth manner, we work with relevant departments in transportation, civil aviation, and construction, culture and tourism, as well as market administration and national resources to make complex and clear deployment for vaccination so as to make sure that we give vaccination to all people eligible and are willing for vaccination. And currently, this process has been quite smooth. Next question, please. With CMG and CCTV, currently the 8th edition for the treatment of COVID-19 has been made public. So what kind of revisions have we made in this latest edition? Thank you, Mr. Li. Well, you may have noticed that the NHC and CDC jointly publicized this latest edition. It's a rendition to the 8th edition. So there are two changes mainly. First is that we add the concept of a principle of diagnosis. So it's a combined diagnostic plan that takes into consideration this patient's history and its clinical symptoms. We also promote that this antibody diagnosis has undergone some changes. So globally, we've seen vaccination rollouts in all countries, and so is China. So if we base solely on the situation of antibodies, it is hard to tell whether the patient is infected or if this person is only vaccinated, so as to trigger this antibody reaction. So if the person is vaccinated, this antibody cannot be used as a diagnostic proof. So this kind of treatment method is only used for patients who have not been vaccinated. These are the key changes. Next question, please. With China Daily, we've heard people commenting on the fact that the efficacy rate of the vaccine is not 100%, so it's not worth getting vaccinated. So can you comment on that? Mr. Wang, please. Thank you for the question. The vaccine are approved. It's approved, and it must be because its efficacy rate reaches a certain level. So it not only can prevent you from getting the disease, but it can also prevent serious conditions, serious cases from happening. So its protection against the serious condition is quite effective. In the past, the efficacy rate of most vaccines is about 90%, and there are also cases of 80% or 70%. But for the vaccine to play a big part, we have to ensure this high vaccination ratio. It is only under this condition can we effectively keep the virus and keep the disease under control. We all know that smallpox have been erased from China, and we are also a high prevalent country for hepatitis B. The rate can be as high as about 90% at one point. However, through this kind of maternal intervention, this mobility rate for children under 5 for hepatitis B has been reduced to less than 5%. So this kind of high vaccination can be a very effective measure to intervene for intervention. So it is not to say that if the vaccine is not 100% effective, it is not worth infection. It is always meaningful to reduce the intensity of spread for the disease and form this kind of herd immunity in our population. Now that we have the vaccine, we need to carry out the vaccination rollout in key population and key areas so as to build this herd immunity as a barrier to reduce the intensity for communication in order to cut the spread of the disease. If all people believe that it is not worthwhile, it is meaningless to get injected because the efficacy is not 100%. Once a source of infection is discovered, there is a chance that it might get prevalent again due to the lack of barrier. And we paid great cost for that in the past. But now that we have the vaccine, and the more people have the immunity, the less possible there is going to have this kind of crowd infection or rebound for the epidemic. Measles, for example, in the past, as an infectious disease, they are quite highly infectious. However, through the vaccination, very high vaccination rate, we've kept these diseases under control. Last year, the morbidity, the number of measles only counts about 1,000 cases. So these are very tangible effects for high vaccination rate. This is an important method to form herd immunity. With Phoenix TV, there are foreign media that reports there are still more than 5,800 cases that has been vaccinated but still got infected, and people believe that it's important to have a booster injection after the first injection. And what is your comment on that? We need a booster as well for the Chinese vaccines. We've also taken notice of such report, but that is 5,800 cases out of more than 70 million. So that is a very small percentage. And no vaccine can be 100% effective. So these vaccination can prevent you from getting the disease, but more importantly, can prevent a case from deterioration and grow into a serious case. I think this kind of protection, the latter protection, is more important. And this efficacy ratio at this aspect can be above 50 to 80%. And besides clinical numbers, we also have more statistics that shows the protection rate is quite reasonable. It's very high. So we hope that our people can be more proactive in terms of getting injected so as to help us to reach herd immunity. And your second question is about the booster injection after 12 months. Actually, this is a separate question. And we were talking about the protection rate of the first injection. Normally, it is no problem that the protection period can last for half a year. That is because most of our clinical trials have only lasted about half a year so far, and we still need time to tell whether we need a booster injection after a year, just as the flu vaccine. You need a booster every year, but we still need more statistics and research to support that. Thank you. We've noticed that the Chile Administration of Health has issued a report saying that it can prevent, its protection rate is about 67% and its protection of deaths is about 80%. So can you comment on that? And their result was issued last Friday, which I believe is very important. This is based on massive clinical numbers, and these numbers can be translated to concrete actions. I think before that, a major research was done in Israel with more than 1 million people. And in Chile, it's now the biggest trial, the biggest research. And this number is quite convincing. From this research, we can know that it can effectively prevent infection and also the tendency for deterioration. This will avoid this kind of depletion of limited medical resources and overcrowded hospitals. Chile, as a very big country, has accumulated very precious data for further research. But despite such high rate of infection, we see that the number of new cases in Chile is still rising. But we believe that it's essential to improve the vaccination rate in order to prevent the rebound from happening again. The people who are vaccinated have experienced adverse reactions, so they may have doubts in this regard. And what kind of adverse reactions are normal, and will it affect the efficacy of injection of the vaccines? After injection, adverse reactions may be felt, and it is closely related to the vaccine itself, but also the personal physical condition. I can give you several examples. In the past, when we are injected with the measles vaccine, some adverse reactions happened within a year, some after a week. And also, when it comes to the vaccine for other diseases, this disease for pertussis, the vaccine for pertussis may also vary from depending on the different categories, different types of vaccine. And another factor that affects adverse reaction is physical condition and age. For example, the chances for young people to experience adverse reaction is higher than that of people of senior citizen. We also have cases that report allergies against the vaccine. If that happened, we would not suggest the person to take a second jab. And there are also people who experience defects in immune system. We also suggest that these people do not get a jab. Especially this attenuated live vaccine, so as to reduce the risk of adverse reaction. But these people can still get injected this inactivated vaccine. So the adverse effect can be attributed to many factors: the vaccine itself, the health condition, the age, and past allergic history. So we've taken methods to reduce the risk for adverse reactions, especially the drastic ones. With Bloomberg, my question is, there are research saying that vaccination can encourage mutation for the COVID-19, for the coronavirus, which will deteriorate the epidemic. So do you have comment on that? I think this is kind of theory is groundless. The mutation of virus for RNA is quite normal because the virus is constantly replicating itself. In order for it to replicate itself, within the few weeks for the infection, and it is mutated through the transportation from the spread of the disease. So in order to stop a disease from spreading, we first need to establish this very good, very effective public health system so as to prevent this kind of pandemic from happening. And second is through vaccination. We've noticed that in some Asian countries, they've kept this disease under control in a short period of time, but it's not the case in many European and Western countries. Vaccinations are effective methods to cut the spread of the disease. So if the virus is not spreading, will not replicate itself, and it will not mutate, will not have the time to mutate. So vaccine definitely plays a very positive role in this process. Even without the vaccine, even without the vaccination, our immune system may produce antibodies once it gets infected with the virus. So it's not because of the vaccine that antibody is generated. But if a person is injected with the virus, it will intensify our antibodies and increase the number of antibodies so as to guard against possible infections. So massive rollout for vaccine can help us to buy time if immune strains were discovered. And the pharmaceutical companies will have more experiences even if this kind of mutated strains are discovered. So the vaccine can be very effective to curb the trend instead of deteriorating the situation.
知道一下，因为马上五一假期就要到了，那么在假期期间，我们还能不能继续接种疫苗？谢谢。
好，我们请崔刚先生来回答这个问题。
好，谢谢这位记者朋友啊。前面已经跟大家介绍了啊。目前呢，各地呢正在按照中央的统一的部署啊，积极有序的去推进新冠疫苗接种工作啊，在实施过程中。
Currently, the local governments are rolling out their vaccination plans according to the requirement of the central government and party committee. So the administrations are asked to open up reservation channels for the people, for the vaccine receivers. In order to improve the quality of vaccination services, we are doing a redeployment and retraining for the vaccination rollouts. And coming up, we will continue to work with the local governments and guide them to improve their quality of services and coordinate the work during this May Day holiday so as to improve the sense of accessibility and gain for our people. With CMG, my question is that the medical workers are fighting at the front line of fighting COVID-19. So can you tell us more about the vaccination situation for medical workers, Mr. Li? As you mentioned, the medical workers are fighting at the front line for treating the disease, and they are facing very high risk of infection. From last year, when we first rolled out this vaccination plan for key populations, medical workers are one of our first priorities, and we asked the local governments, first designated hospital and then the other hospitals, to carry out vaccination. And we asked the local government to coordinate the work to give access to the medical workers, but we also avoid this kind of compulsory policies. And so far, the vaccination rate for medical workers is over 80%. Next question, please.
谢谢香港中评社记者提问。不久前，《新英格兰医学杂志》发表文章，针对阿斯利康疫苗接种后血栓。
Not long ago, the New England Journal has comment on the adverse effect for the AstraZeneca vaccination, as well as some adverse cases of Johnson & Johnson vaccination. And does the Chinese vaccine have a similar consideration? So safety issue is the first priority for us. We've also taken notice. There's a paper published in New England Medical Journal, according to which the AstraZeneca vaccine has the possibility of producing clots in blood. And the Johnson & Johnson vaccination has also been suspended due to similar reasons. And they need to do further research before deciding the treatment for Johnson & Johnson. The morbidity rate for such adverse effect is still quite low. And the morbidity rate in different age groups also differs from one to another. The higher the age, the higher the risk. That's why some pharmaceutical administration in Europe have suggested against the vaccination for people over the age of 50. In China, the vaccine for Sinovac has administered about more than 1 million doses, and so far no similar symptoms have been reported. We have a very sound surveillance system for adverse effect, including thrombus. So once similar situation is discovered, we will take measures immediately. However, I should say that even with such possible side effects, it is this benefits for injection is still much higher than the possible risks. And with careful surveillance and sound this kind of inspection system, it is still worthwhile to carry out the rollout for vaccines. With Beijing TV, what kind of role does vaccination play in COVID-19 prevention control, and when will herd immunity form, and what does that mean to us? Actually, the prevention control for communicable diseases has been very prominent, has been made very prominent through this COVID-19. So first of all, we have to control the source of infection, including the asymptomatic patients as well as infected patients that have shown symptom. So we need to do that through a quarantine and for observation. Second, we need to cut the channel for transmission. For example, some of the self-protection measures, wearing a mask, wash your hands, and avoid gatherings. But these two methods are not so targeted for the susceptible groups. Vaccination is the most effective methods still. So for vaccine receivers, most of them will generate antibodies, which will in the end generate this kind of barriers against this barrier against disease, and it may form protection to the group, to the crowd, and that's what we call a herd immunity. So vaccination is a much more effective measure compared to the first two methods. If we look at the status quo, we can see that all countries are taking methods, the first two methods, to control the source of infection and to cut the transmission. However, new cases are still being reported. It cannot effectively cut all transmission. Now that we already have the vaccination, the vaccines, it is important for us to carry out vaccination rollouts against the backdrop of global pandemic. This kind of intensity of pandemic has to be reduced from a pandemic to an epidemic. And we are aiming at reducing this trend and ease the trend of infection. So vaccination is a key link to that. We need to, first of all, build the barrier against the disease so as to reduce the intensity for the epidemic. This kind of immunity barrier is just another way of saying herd immunity. And this kind of barrier is dependent on the rate of vaccination. The higher the vaccination rate, the higher and stronger the barrier would be. And second function for the establishment of the barrier is to buy time for us to guard against possible mutations. If a person is not immune at all to the virus, he or she may be it is easier for him or her to get infected by the new strain. And the mutation of the virus inside his or her body, this kind of possibility is also higher. However, if the people that have antibody number is huge, this kind of transmission will be limited to a very small scale, or the possibility would be largely reduced, and in the end, it will erase the disease. And third, if you want to get injected, the doctors will ask if you have some urgent health conditions. And we also right now suggest that people under the age of 18 to not get infected. And some people are allergic to the vaccine. So there are people who are not eligible for vaccination, so that they will not have antibodies in themselves. However, if the vaccination rate is higher, is very high, it will be enough to protect the other people who cannot get injected. This is what we call this immunity barrier or herd immunity. Last two questions. First, according to the 8th edition for COVID-19 treatment and diagnosis, why is antibody not used as a diagnostic proof for people who already are vaccinated? Actually, Mr. Li has touched upon this point in his answers to a previous question. Once a person is infected, antibodies will generate. And it's actually the same story with people who get vaccinated. If you're vaccinated, antibodies will also be generated inside you. So this kind of positive results for antibody is not enough to judge whether a person is infected now. In the past, it's okay, But right now, we have already administered more than 200 million doses. Therefore, it is not advisable to use antibody as a diagnostic proof for the vaccinated population.
好，最后一个问题。好，来，请左侧去第一。
Last question, please.
谢谢主持人，新华社记者。就是我们知道，这个我国从抗击疫情
With Xinhua News Agency,
布局了这个5条疫苗研发的
from the very beginning of fighting COVID-19, we have 5 technical roadmap in terms of vaccination R&D, and right now we have seen this marketing of 3 vaccine of 3 roadmaps. So can you tell us more about the other 2 technical methods? Thank you. The Chinese government at the very early stage of the COVID-19 has made 3 priorities, 3 suggestions. So the inactivated and this attenuated live vaccine has already been approved and has been marketed. So we are among the first region in terms of vaccination. We not only are protecting people of our own country, but also are giving medicine. We are sending medicine to other countries to protect them. We also have 2 other technical methods, that is attenuated live vaccine based on flu virus, and also the M2 virus and DNA nucleic acid vaccine are at the clinical trial stage, and so far the results has been quite positive at the moment. And right now they have entered term 2 in clinical trials. So the key questions that we are facing is quite similar. Because we control, in fact, we are now effectively keeping this virus under control, it is not practical for us to carry out term 3 of clinical trials in our country. So we have to do this in other countries. We've seen deterioration in other countries, and we are doing clinical trials in some of the projects. However, there are ethical issues concerning the trials because people want to get injected with a real vaccine rather than placebos. So this is one of the practical problems that we're facing. But we are still advancing our trials despite some of the problems and difficulties we are facing. So our general aim is to make sure that all the vaccine types that we are researching and developing can be put to use as soon as possible. Thank you very much for attending today's press conference and briefing us on the situation of vaccination rollout. And we will organize press conferences in the future.